Good evening, Congresswoman. Good evening, Bishop. Good evening, Dr. Elijah Day. So good to see you all.
Thank you.
It's a pleasure.
Thank you. Well, we are going to get started. Had a minor technical difficulty, but nonetheless, we are here. We have the numbers are growing. We have about 113 people on, and the numbers continue to climb. Thank you all, everyone who's joined from around the country. We have our distinguished guests that are on with us tonight, and I'm certainly excited that each of you have joined. To just give you a little bit of context, we started Monday Mentoring Moments as a response to what is happening with COVID-19. And we have a group of about 1,000 SOARs, individuals that we call that are committed to service and committed to soaring. And we've come together and we have fed 3 hospitals in New York. We have fed Mount Sinai, Sloan Kettering, and Jacobi Hospital, and fed the medical team. Then we came back and said that there's more that we could do. So then we fed 100 seniors. We also gave 100 families $100 gift cards to help them feed themselves. And then most recently, we took care of single mothers and grandmothers that are raising their grandchildren and surprised them with gift cards, because we realize that there are so many people that are impacted by this COVID-19. And so in tonight's discussion, I pulled each of you together because I want to talk about, as the country is addressing reopening, I want us to talk about rebuilding. And I read a very interesting article by Dr. Michael Youssef, who said the art of rebuilding is to address the gap and to ensure that there is not a gap. And so tonight, I want to talk about just that. How do we address the gap and make sure that there's no one left behind? So what we'll do in terms of our town hall discussion tonight, for a flow, I will introduce each of you and ask you to just share short greetings. And then I will go into the very specific questions that we have for each of you. And before we get started, I just want to say thank you to each of the panelists. The work that you do sets up the entire country to be in a better position. And I'm honored that you are here with us tonight. So I just want to open up. We'll start with ladies first. Congresswoman Sheila Jackson Lee, we are honored that you are with us serving the 18th Congressional District of the House of Representatives, and you are there with us, I believe, in Houston or in Washington. Greetings to you, Congresswoman Jackson.
It's a delight. As you see, I have on my mask that is being required by Houston and Harris County, that everyone as of today is supposed to wear a mask. Since I'm here in the intimacy of one person in the room, I'm going to just have it on halfway and be able to communicate with all of you. First of all, thank you. It is an honor and privilege, Ivy, to be with you and to be with Bishop Jakes, of course, with the reach of brilliance and leadership that he has, and also his offerings of faith, and to Dr. Williams, who, as I said, is in the eye of the storm. We all are in the eye of the storm, but we are required in the midst of the storm to be busy until he comes, meaning that we must do for others. And so the work of the census must continue, and I'll have a comment about that, but I think a comment that I'll repeat when I give my response is that we're reminded of the fact that when the Constitution was written, African Americans were only 3/5 of the person. That was supposed to be a compromise. How tragic and how sad, so that we would not have representation, so the South wouldn't have more representation than the North. We cannot let that tradition stand today. The census must be something we grab onto. And then finally, I'm holding in my hand a card that was written by a 9-year-old from Houston, Texas, that says, "A hope note just for you." It's from a little girl called Abby, and she just wanted to make sure that everyone knew how special they are. Even in these times of COVID-19, we must recognize that each person is special. Each human being deserves to be tested, deserves to have the adequate access to medical care. And as I've seen you do have access to resources so they're not food insecure. So with that in mind, I look forward to us being able to discuss many of these issues and to hear them from the different perspectives of our wonderful guests. Thank you so very much for having me this evening.
Thank you so much, Congresswoman. We will look forward to a vibrant discussion with you. And next, I would like to introduce my friend. He is my medical go-to on anything and all things. And as Congresswoman said, he is in the eye of the storm in New York City. I'd like to introduce to everyone Dr. Olajide Williams, who's been a longtime friend of mine. He is the Chief of Staff of Neurology at Columbia University Hospital in New York, but also he is the founder and CEO of Hip Hop Health. And you are going to be fascinated by what he has been doing for years and years and years in the world of health disparities. Welcome and greetings to you, Dr. Olajide.
Hi, Ivy. I just want to thank you actually for all the incredible work and support you've provided to us frontline workers. I want to thank you for putting this virtual town hall together in support of communities of color impacted by COVID. I just want to say that it's kind of surreal sitting here with Bishop Jakes and Congresswoman, Sheila Jackson. You've both, I've admired both of you for many, many years. Bishop Jakes, your words of wisdom and comfort have really helped me over the years. And Congresswoman, I see you all the time battling for our rights and for equity in the work that you do in Congress. So I just want to say thank you to both of you for all the work that you do. To be a physician on the front lines during, a pandemic, Ivy, it's kind of surreal. It's really one of the most challenging experiences that I've had in my entire career. I've seen so much suffering, so much trauma, despair, so much disability and death. And a lot of my patients are going through this alone. And a lot of them are brown and black and brown individuals. But I've also been really inspired by the heroism of our patients, by the courage of my colleagues on the front line. They've been truly amazing. Just today, Ivy, we discharged our 5,521st patient with COVID from our New York Presbyterian system here in New York City. That's amazing. 5,521 discharges in just our hospital system since this began. Am I hopeful that we're going to get through this? Yes, I am. Am I confident that we're going to learn from the mistakes that we have made? I hope so. And am I optimistic that the spotlight that has been shed on the disparities related, the healthcare disparities related to COVID, are we going to learn from them? Again, I hope so. But one thing that I have confidence in is our resilience and our ability to continue to fight against social, economic, and healthcare injustice.
Awesome. Thank you so much for being with us, Dr. Olajide. And we have so much to learn from you. Bishop, can you hear us?
I can hear you. Can you hear me?
Oh, yes, we can now. There was some sort of technical difficulty.
Okay,
we just wanted to greet you and say thank you so much for being with us tonight. Again, if anyone missed, I wanted everyone to know that a bishop is heralded as the voice of faith across the country. He is also said to be America's pastor, and he is the senior pastor, the founder and senior pastor of the Potter's House in Dallas, Texas. Bishop, thank you so much for being with us tonight.
It's a real honor to be here and to be on such a prestigious platform with so many heroes and sheroes who are from different perspectives working for the betterment of our community. I just want to pause and thank you, Ivy, and to thank each of our guests that are joining me for their participation in a process. And I think that you have embodied in this group a message that I've been trying to herald across the country, that it's not going to take one of us, but all of us from our different perspectives in order to really make the kinds of difference that's needed for people to have a better life and a well-meaning life. And for the doctors on the front line, I noticed that you mentioned in your early remarks about feeding those that were on the front line. We've been doing that too. We're getting close to 5,000 meals that we have fed for people who were working at the various hospitals. This is a high density area of extreme medical facilities. And we've been working with a lot of them, as well as people who are disenfranchised and at home and need food and support. But it's got to go further than food and sermons and words of encouragement to systemic change that brings about the kinds of change that people become self-sustaining, that they have access to appropriate health care, that they have access to appropriate opportunities. And we've been working on jobs through our foundation. We've been working on housing, because most of the time the people who work to save us in the cities can't afford to live in the cities that they work in. And so as we work and grapple with these problems and start talking about solutions, these are some of the things that I hope that we keep on the front burner once the hysteria and the chaos of this current moment subsides, that it doesn't digress back to business as usual, but we use this as a moment to plummet us sociologically into a more equitable society for all people concerned. And I just deeply, deeply admire, I'm a neighbor to Congresswoman Sheila Jackson Lee. She's in Houston. I'm in Dallas, and they're not the same cities. People sometimes think they're the same, but they're close enough that I'm well aware of her work, and I deeply admire what Dr. Williams is doing as well. And thank you, Ivy, for bringing us all together.
You're so welcome. Thank you, Bishop. I'd like now to go into the individual questions. And so I will ask each of you a question, and then we will open up to questions from the viewers. The first question, again, ladies first, is to you, Congresswoman. And your question is, we are in an election year, a census year, and in the middle of a pandemic. The census only happens once every 10 years. Can you talk a bit about the systemic inequalities that keep Black people from voting and participating in the census? That's question A. And then part B of your question is, what can we do differently to make sure that we are counted and heard, especially in light of COVID-19 crisis?
Ivy, thank you so very much. And I have to weave into my answer, of course, where we are today in the historical moment that we happen to be in. I don't think we've ever faced an obstacle like COVID-19 in our modern day history, and that is when the world almost stands still. But we know, as I said, that the census is embedded in the Constitution, where we're to count the people every 10 years, no matter who it is. There's no question of whether you're documented or undocumented. If you're a household, you're counting every single one, even the little baby boy and girl, obviously, up to the oldest person. And for many times in the past, African Americans have been undercounted, sadly undercounted, sometimes to our own responsibility. I don't want to be counted. They'll call me for jury duty. None of that is true. One thing about it, the Congressional Black Caucus collaboratively, for those of us across the nation, have been very in tune with the question of census. We added $5 billion, to the census account. As the year began, we were in the midst of a massive hiring of people across the nation to be part of the census counting process. And I hold in my hand an operational adjustment. We were going to be working in the month of March, in the month of April and May. We're going to hire people. We're going to have mobile sites where people would go into neighborhoods and find out who had been counted. That has been delayed. But what I can say is that you can be your own self-liberator, if you will, your own civil rights activist. You can still get online to do your census. I hope that many have done so. We're just delaying the personal outreach that is going to come about later on in the months to come. But if we are undercounted again, as African Americans tend to be in all of our cities, we lose out on healthcare, we lose out on education, on environmental resources, on infrastructure resources in our communities. It is very real that the census dictates in many instances where those dollars go. And as Dr. Williams will articulate about disparities in healthcare, we've all worked on together, admiring his work, admiring the leadership of Bishop Jakes, whose voice is heard. It is very clear that COVID-19 is reflective of those health disparities. It pierces the hearts of those of color, African Americans and Latinos. Way down here in Texas, the highest numbers of those who have died are African Americans and Latinos. And where places were absent of testing, where people could not get tested, all of a sudden now the protocols of testing is allegedly moving up. But it was in the beginning of this COVID-19 that we could not get testing in our community. We, however, have set up testing sites in inner city neighborhoods in the 18th Congressional District that I've been able to set up for people to test. But all of that can be tied to funding that is related to the census. What we can do is to organize our own census committees. Now we can do it virtual. We can organize through fraternities, through faith institutions, through civic clubs, and just remind our neighbors to get online and fill out the census. It is painless. It has nothing to do, as I said, with jury duty, though I hope that African Americans and Latinos would really relish to serve on juries because that's the justice system. But it has nothing to do with that. It has nothing to do with bill collection. It has nothing to do with any question of your personal matters. It is very generic information to give your age and what your race is and your address to let us know that you are there, that you're in this house, or that you're on this block, or that you're in this city or this county. So what we can do is we can self-organize even during this time and self-preach the point. If you really dwell on it, do you realize in 1790, you are not one human being? That's what we've lived through as African Americans. And so out of that indignity, shouldn't you be the first to sign up to be counted when you are only 3/5 of a person for a long period of time? In fact, until the Emancipation Proclamation, you were 3/5 of a human being. So I think it'll be internal organizing. That'll be aspect of it. And then we can just look at where we are today in COVID-19. Just think in COVID-19, if we did not have at least some of the dollars for Dr. Williams to work with to sort of bust open those disparities in healthcare. That's what this means to us.
So good. And I like that you've given us something that we can do. I like what you said about organizing virtual census groups and committees to engage people, to engage their colleagues and friends and communities, because this is so critically important. So thank you for that, Congresswoman. All right, we want to keep it moving. Dr. Olajide, COVID-19 has affected more than 2 million people around the world, killing at least 150,000 people. The data shows in the United States that Black people are far more likely to get sick and die from COVID-19. Across the country, there is currently a shortage of critical supply for health workers, and we are without mass testing sites. As the chief of staff of neurology at one of the country's leading medical systems, the esteemed Columbia Hospital, also you have remained close to the pulse of health disparities and started Hip Hop Health. Can you discuss how the transformative power of hip hop and music in general can foster behavior changes as it relates to people taking responsibility for their health, and how people can protect themselves as states prepare to reopen? I think you are on mute, Dr. Olajide. You'll just want to unmute yourself. You'll press the microphone. If you tap on your image, okay, speak now, Dr. Olajide. All right, if you'll press your screen again, there is a blue microphone. If you'll tap that microphone. All right, Hamdi or Keenan from the IB Inc. team, if you can reach out directly to Dr. Olajide's assistant. Dr. Olajide, if you press the blue microphone. Still not hearing it. Okay, Dr. Olajide, check your phone. Keenan or Hamdi will reach out to you and we'll come back to your question, okay? Awesome. Bishop Jakes, we are going to move to you. We've heard, gleaned, and learned from you as the voice of faith and seen you sit on some of the most widely respected media outlets, sharing hope, peace, calm, and wisdom. In addition to being the nation's pastor, you're also a strong business leader, and this year launched the TD Jakes Foundation. And how timely that you're advocating for jobs for displaced workers. You've created a model by which others can also use their business acumen and influence to help and bring about change. Can you share with us a little bit more about the TD Jakes Foundation and how faith and businesses can come together to not only help displaced workers, but help our economy and help individuals collectively?
Well, thank you again, Ivy, for this opportunity, and I'm just honored and privileged to be here, and really humbled to be around such magnificent people who have done so many amazing things for years and years and years. I started the TD Jakes Foundation because I felt it was incumbent upon me. I have a unique position because of my business life to live in both worlds. So I'm constantly in meetings with CEOs. And then because I'm a pastor, I'm constantly interacting with ordinary people. And there seems to be a gulf between the two, because when I talk to the CEOs, many of them seemingly want to do more. They want to do more hiring. They're trying to access more Black and brown and female people into positions that they don't really know how to access. And there seems to be a feeling in our community of being overlooked and ignored. And I started the foundation so that we could be a bridge between those who have the services and those who need the services, so that the community could be uplifted. And they can go to our tdjfoundation.org and see that there are many, many job opportunities. We're starting first regionally and then going nationally and hopefully globally, with an effort to bring awareness and a collaborative effort between CEOs, elected officials, community leaders, and spiritual leaders, so that we can make sure that this connection is made, so that there are appropriate opportunities allocated equally and dispersed amongst all people without any distinction or differentiation one from the other. The other dynamic of the foundation that I'm really interested in and had started into even prior to COVID-19, I've had a deep concern about workforce housing, because I'm concerned about the regentrification of our communities. I'm concerned these opportunity zones, if we don't access them and bring in workforce housing into them, it will ultimately regentrify our communities and leave us further displaced. So the people who are driving the fire trucks, who are serving the city, who are working in the hospitals, who are working downtown, are living further and further out, or they are house poor. They're living closer in the city, but they can't buy furniture in the house. They've got a car and they can't get gas in it because we don't have workforce housing. I'm hoping with all of this attention on first responders, people who are delivering food, people who are driving our trucks, people who are taking care of our loved ones, not just the nurses and the doctors, hats off to their amazing service, but also the janitors and the interns and the people who are cleaning up in the hospital and putting their lives at risk every day to make sure that our loved ones are cared for. Right now, we're saying a lot of wonderful things about them. We're giving them tributes and clapping and singing and doing a lot of wonderful things. But what really needs to happen beyond all of that, and I'm not belittling that, we need to do all of that. But beyond all of that, they need better pay. Our teachers need better pay. Our service workers need better pay. Our food handlers need better pay, so that the greatest thing that we can give them, rather than a God bless you and thank you for your service, is fair opportunities at equitable pay, raising up minimum wages, making sure that when they go home at night, their children are educated and taken care of, and that they don't have to drive an hour or hour and a half or 2 hours to get back home. Those are the things that's the best way America can say thank you. And I think it's something that all Americans want to say. I don't see how you could be a decent human being and not want to say thank you, right down to the people who are working in the grocery store, for people who are putting themselves in harm's way to make sure that we're taken care of. And since God has allowed that to come center stage for such a time as this, The best way that we can give ultimate tribute to these people is to make sure that they're compensated properly and that they have access to healthcare opportunities, housing, and job fairs. And so I started the foundation. We're looking at workforce housing across the country. We're targeting many cities across the country. We started here in Dallas, and we've also become a liaison between CEOs and mainstream America. If you're looking for jobs, there are jobs on there. We're going to grow that out, and we're going to build a foundation. So faith without works is dead, being alone. So it's a nice thing to preach a nice message, but it's time for show and tell to happen. It's more than words. It has to be in deeds and action.
That's so good, Bishop. And when you were talking about the teachers, recently there was a conversation about the number of people that are now at home with their children, and now they have a better respect for what the teachers do. Also, we're seeing, truck drivers are making it happen while our country has been shut down, but now everyone has a greater appreciation for truck drivers. So all of these essential workers that weren't classified as essential prior to COVID-19, now everyone has a different respect level for them. So I like what you're saying about in terms of better pay. And I think following COVID-19, I think a rush in terms of pay equity is just on the other side of this. So thank you very much for your comments. Dr. Olajide, are you back with us? All right, so I tell you what we're going to do. I'm going to call you, Dr. Olajide, and you will stay right there on screen, and you will just talk to us through. All right, you there, Dr. Olajide?
Yeah, can you hear me now?
I can hear you now. I'm not sure what it is, but never think that technology and a Black woman won't figure something out. All right. We're anxious. We are anxious to hear from you. And we want to hear your observations on the question on how COVID has affected so many people. And your question is, how can you discuss how the transformative power of hip hop and music in general can foster behavior changes as it relates to people taking responsibility for their health? And then secondly, how can people protect themselves as states prepare to reopen?
Yeah, so one of the first things I want to just say is that I've never in my career been in a situation where the wrong behavior can not only kill you, but kill your entire family.
Wow.
And this is a highly transmissible disease. And we have a situation where it's often an asymptomatic disease, especially among young people who can bring this disease into their homes and infect their grandparents and their parents with devastating consequences. And so personal responsibility over these safety precaution behaviors is critically important in this time. Now, the challenge that we're having, especially in communities of color, is that public health communication has often failed to effectively penetrate a lot of our communities with messages that resonate and have the ability to promote behavior changes. Mm-hmm. And so what we've done is that we try to leverage the pillars of persuasion in our interventions. We know, for example, that messages need to be credible. They need to come from a trusted source. We also know that messages need to make sense to people. People need to understand what it is that is being told, what they're hearing. And it also needs to be compelling enough to create a favorable cost-benefit analysis that results in a favorable response to the message. Mm-hmm. And finally, these messages need to be able to motivate individuals. And this is where the emotional connection to the message comes in. Our bishop does this brilliantly, but unfortunately, public health doesn't do it very well. And so what are ways that we can manipulate these variables? And one of the ways that we found in our research, especially when targeting the youth, is that music is a very powerful form, a very powerful medium to use. As a neurologist, I know that music occupies more neuronal real estate in our brains than language itself. It has very powerful effects on our brain functions. That's one of the reasons why music has the ability to motivate, to enhance memories, has the ability to create positive associations. It can even augment learning. But unfortunately, we are not leveraging all the tools we have in our toolbox within public health communication. And so that is one of the reasons why, after the research that my group conducted at Columbia, we felt that using music as a public health communication vessel for the youth in communities of color will give us a great opportunity to help improve behaviors and really, press upon them the importance of personal responsibilities in this, not only in this time, but going forward as we seek a land with greater equity. And so Hip Hop Public Health was an organization that I founded with Dougie Fresh. And around the time of the pandemic, when I started seeing a lot of patients in the hospital with COVID, I realized that we need to really get back to the basics. And we know that if you just look at simple hand washing, just hand washing alone, Ivy, it has the ability to reduce the rate of respiratory infections from viruses by up to 21%. And hand washing is also critically important because, we touch our faces about 23 times an hour. And most of that is unconscious. And so, yes, we can wear our masks, but often we take them off when we're home and we touch our faces. And then even the way we manage our masks is a whole nother topic, because there's a way that you have to look after your mask, especially when you're reusing it. And so we decided to take hand washing as something that needs real ownership by everyone. People need to be responsible for the simple act of hand washing, because that is one thing that we know can really reduce the transmission of this virus and protect families. There are other things that we need to do, like social distancing and wearing face coverings, staying at home, quarantine, but hand washing is one of those things that we really need to emphasize. And proper hand washing technique is rarely practiced by a lot of individuals. People don't realize that you really need to wash your hands for up to 20 seconds, at least 20 seconds. At least that's what the data tells us. And so we got together at Hip Hop Public Health to create a PSA about hand washing. We gathered about 30 or 40 hip hop artists together. It was a song that was written by one of our producers, Artie Green, and Dougie Fresh was the lead rapper on it. And it has a simple message: wash your hands for 20 seconds or more. So these are the type of creative public health communication methods that we need to employ as we go forward and try to educate our communities. And so that really is one of the reasons why we've embraced hip hop as a strategy within the public health toolbox.
Dr.
The second question, Ivy, is regards to how can people protect themselves as we prepare to reopen. Well, I just want to say that, I'm very nervous about reopening too quickly. I think it's a very dangerous precedent that a lot of governors are exercising right now by rushing to reopen some of our states. We are very nervous about a second wave. And because we believe that if there is a second wave, people are already exhausted. My colleagues and I are already exhausted. People are hungry. There's food insecurity and the damaging effects of the current epidemic. And the infrastructure and the unemployment and the suffering is at such high levels that I don't know how well we will do with a second wave. And so we have to get this right. And that means we need to rapidly scale up testing. But I also want to point out that it's not just testing, because we need valid testing. What I'm seeing over where we are is a fairly high rate of false negatives. In other words, people who have the disease are testing negative for the disease. Some people have put this up to 15%, but we're seeing numbers that might be even higher than that. And so getting valid tests out to the communities is very, very important. The other thing that we need to do is to really expand our capability to do contact tracing. But not just that, when we trace these contacts and we find them and we test them and they're positive, we need to be able to quarantine them. One of the things I just want to say before I wrap up, Ivy, is that there are barriers to social distancing. For some people, it just can't be done practically. You have many people in our NYCHA housing, in the projects here, in Manhattan, who just cannot socially distance. And so when one person gets infected, if one person has mild symptoms, it spreads very quickly throughout that home and that housing projects. And so we need to be able to find, quarantine units, isolation units, where we can take people, who are unable to socially distance or self-quarantine in their homes and put them in comfortable places where they get 3 meals a day, where they're cared for, they're looked after for the duration of the time that they are shedding the virus before we put them back in their homes. We had a lot of empty hotels across New York City during this pandemic.
That's right.
And one of the things that we could have done, and I know that the mayor is really looking at these strategies right now, is to try to use some of these available housing units to help isolate people, especially those in communities where they just can't afford to have spaces to multiple rooms.
That's right.
And so these are some of the issues we need to think about as we move forward and try to contain this virus.
Such invaluable information, Dr. Olajide. Thank you so much for sharing such rich information. I want to pivot quickly and ask both the Congresswoman and Bishop Jakes, with all of the information that Dr. Olajide has shared, Bishop, from your perspective, I'd like to hear your thoughts on re-engaging and having people come back for worship. And Congresswoman, I'd like to hear from you on when larger city community gatherings or city halls and those things from your perspective are best safe to open. Bishop, I'll pivot to you.
First of all, thank you for the question. I'm glad to answer it. I think that churches are not monolithic. Everyone is different. Every city and region and location is different. And I think that so many times we allow the decision of the elected official over that area to determine what we do as a spiritual leader. When in fact they're not giving us a mandate to open up, they're giving us permission to open up. We still have to make a decision what is right for your particular house of worship. I am not comfortable right now with opening up our church because of the demographics, the high density of people, the vulnerability of people of color to die from this disease. The propensity that we have to interact, this excitement that we would have to be together again. And a lot of them will come not because the president or the governor or the senator or the mayor said come. They're going to come because the pastor said come. And you have to take that responsibility seriously and not delve out that kind of influence without due diligence and great consideration. I think every pastor really needs to take that seriously and then make a decision based on your ability to have appropriate spacing between people, if that's logical in your situation, if the masks are appropriate in your situation, if the facility will accommodate that kind of crowd. Some people are doing multiple services, but right now we're doing streaming. And streaming has been highly effective for us in being able to reach a wide body of people. I can't wait to see our members, but with 30,000 members in our church and 30 million people on our social media databases, we're reaching the world in a way that I think is very unique and very important, because this is not just an American crisis, it's a global crisis. And having that platform to do that I think the sacrifice of fellowship for a little while longer is a small price to pay when I consider that God has given us a platform whereby we can reach the world. Every pastor has to make a decision. If I were in West Virginia and I wasn't streaming and I had a smaller congregation and I had the opportunity to sufficiently space my congregation, I might make a different decision depending on how strong the infection had broken out in my area. But you have to be guided and stand up and be a leader and not a puppet, and not just open up because somebody said on the 15th, you go back to church. So like a puppet, you go back to church. You have to give an account before God for those people. And I'm very careful about how I use my influence to invite our people into what might be a death trap.
So good. Thank you so much for your response, Bishop. Congresswoman Sheila Jackson Lee, I will pivot to you for the same answer to the same question. I'm sorry.
Thank you. Well, while I have Dr. Williams, I'm sure that I've taken off my mask probably in a different sort of way, but I'm well aware of the fact of making sure that you not touch your face and use the mask well. And I thank Dr. Williams for that very eloquent and important statement, along with the very insightful statement of Bishop Jakes. And that is, I guess, where I will start, is that we must be instructive, insightful, informed, and we must not diminish what COVID-19 is. COVID-19 is a virus, and I am not a physician, but being a policymaker, I well know that it is one that we have never confronted, from SARS to swine flu to H1N1 and beyond, Ebola. And we have not seen a level of contagiousness that we see now. And as well, for those of us who've immersed ourselves in this over the last couple of weeks, watching our health professionals, we also know not only is it contagious, but there are many people walking around, as the doctor said, that are asymptomatic. We also know that 31 of the states in the United States do not have adequate testing. But we know that governors are now rushing to make decisions, in many times against the wishes of mayors, who, as they say, are where the rubber hits the road. Those who are over local government, they're where the rubber hits the road. And so I'm even seeing it in my state of Texas, but again, this is widespread. Tennessee, Georgia, Texas now, that, we're going to open up 25%. But we look at the video, we'll see the beaches are crowded, the parks are crowded, people are giving up on social distancing. And I am fearful that we are premature, that we are not ready, and we're not sensitive to people's cultural mores. What does that mean? You give an inch, as my mother would say, and folk are running a mile. So my caution is that we need a testing protocol where we feel comfortable that we're at the levels of testing across the nation. You know, we're still 2% testing of the population of the United States. We heard today a report that they're trying to go up, but that is on April 27th. We're not where we need to be. Then the other thing is the people that don't have access to good health care, the disparities in our neighborhoods, the fact that inner cities or places that many of us represent in the United States Congress have not had an ongoing access to be able to just go out and get tested. When we first started, people were charging. We're the ones that opened up in the advocacy to ensure that we could have free testing. When I say that, many of us in the United States Congress, members of the Congressional Black Caucus, kept fighting for no charge testing. And I don't know if we could say we have it everywhere. So my point would be that we are not ready to fully open. How do you parcel out 25% of your business being open, 25% of your restaurant, 25% of your retail? And as Bishop Jakes has said about faith, places of faith, I'm going to leave that to his articulate expression. He's absolutely right that it has to be the determination now of that leader, of that faith institution. But what happens to this question of businesses? We know that people are suffering. That's why we put an extra $370 billion to provide for small businesses. But leadership is tough. And I think it is important to say to those businesses that we want strong, healthy lives, as well as we want a strong economy. And maybe I'm an optimist. Maybe I'm like the little girl that I just showed here and said, I hope a hope note just for you. And that is that you're not forgotten and that this economy is going to come back. This is the richest nation in the world. These dollars of investment will be there. We'll take up some of the issues that Bishop T.D. Jakes has spoken about, excellent ideas of workforce housing and otherwise, HUD monies, education monies. But if we rush forward too quickly, if we do it in some of our most, how should I say it, vulnerable communities, some of my brothers and sisters from all backgrounds, all racial communities who are impoverished, we may have a mountain too high to climb. I just want to finish on this note. When we started this, again, Dr. Williams, I am not a doctor, but when we started this, it was all about people with pre-existing conditions. That's why Black folk have it, and that's why Latinos have it. But you know what? We found young, vibrant African Americans with COVID-19 that have died or been very, very sick. There's something more to this that requires a cerebral, focused research, just as we're doing on the vaccine. Vaccine is not expected until 2021, as much money as we're putting into it. So I would make this argument. Let us not rush to judgment. Let us not rush to make decisions based on the eagerness of the economic call, because we're not a poor country. And I think that we can withstand this for a little bit longer to make sure that our people, whoever they are well enough to be able to face and confront another surge of this very contagious disease. Again, I hesitate and call upon our leaders, as I did today, that we not rush to opening up our communities, our cities, our nation too quickly before a testing protocol, before a treatment protocol, and before we can know the results of the tests that people are getting.
Thank you so much, Congresswoman. We're now going to move to questions that have been presented by our audience. And I want to give a shout out to the audience. You all have sent in amazing, absolutely incredible questions. Dr. Olajide will have a first question for you. Then Bishop Jakes will have the second question for you. And then we will come around to you, Congresswoman. The first question to you, Dr. Olajide, is, as we feed the hungry, more people are voicing their concern of the lack of testing, to Congresswoman's point. How can we advocate for more testing sites, and how can we get free testing sites?
So I think that's a really important question. And, the local municipalities, the state governments, the federal governments, I think it's really important to align. We have the labs that can do the tests, but sometimes some people don't have the reagents and the tools to administer the tests with. And it's also very important for us to make sure that the tests that we are administering are approved tests, and they're tests that are valid, because we know that there are tests out there that really don't have good validity. And so it's very important that we make sure that the tests that people are doing are tests with, high sensitivity and specificity. As I said, there are false negatives out there, even with the tests that are approved. So I think it's very important to focus testing. One of the things that Mayor de Blasio has done here is he has a very aggressive testing campaign focused in the hardest hit communities.
Yes.
So that he set up testing sites in across our NYCHA housing, the New York City housing. He set up aggressive testing in our nursing homes, and a lot of the hot spots is where a lot of the focus of the testing and the testing sites are being set up. So I think it's very important to really focus as we begin the rolling out of wide-scale testing, to really focus on communities that have been hit the hardest. But it's not just testing, because it's what do you do after you test someone. You have to have the ability to do contact tracing to make sure we identify who else was exposed to that individual and make sure we test those individuals. And then it's not even just testing those individuals, it's what do you do with them if they live in an urban community in a one-bedroom apartment with 7 people? How do they self-quarantine in that situation? So you have to have a plan for what you're going to do with folks like this. And so that's why I really appreciate what the Congresswoman said, that we really have to make sure that we are ready for reopening, because these are the issues that really need to be worked through. And the nuances, especially when you're dealing with urban, highly dense communities, are myriad. And it's very important to have a coordinated plan to really make sure that we don't miss important cases. Because if we fail to get this right, we've seen, so many deaths here in New York City. It's just terrifying, the thousands and thousands of people that have died in this city. And so I don't want any city to go through what New York has gone through, but we have to get this right. Otherwise, other cities might even get it worse than New York. And God forbid, we see the dreaded second wave, the resurgence of this. We just don't have the infrastructure right now to cope with a second wave.
So good. Thank you so much, Dr. Olajide, and thank you for your service as having been on the front line and continuing in your work. Bishop Jake, several questions have come in to you specifically around faith. Some of the questions around faith leaders that have actually passed from this COVID-19, and more specifically, some of the questions that have come in for you is what is a message of hope or a message of faith to so many who have been closely impacted by COVID-19, and how do people maintain their faith during this trying and unprecedented time?
Wow, that's a lot. First of all, I think that we need to recognize that faith has always been at the underbelly of our culture and our society, that has been the fuel that has helped us to withstand the vicissitudes of life. As a rule, we don't tend to be the kinds of people who run away from God in times of trouble, but rather run toward God. Most of the pastors that I'm talking to and that I'm interacting with, which is quite a cadre of pastors, are bombarded with phone calls because not that people aren't believing God, but that they are definitely trying to believe God and trying to hold on to their faith in the turbulence of our time. I'm concerned because we've got families who lost the loved ones that Dr. Williams are talking about, whose loved ones died alone. They weren't able to comfort them. They weren't able to hold their hands. They weren't able to say goodbye to their mothers, their brothers, their uncles, their aunts, their pastors. We've got many, many pastors that have been deceased. We've not been able to memorialize them, to honor them, to funeralize them. There's not been closure in an appropriate way. The mental health issue after this is going to be overwhelming. And right now, the best chance we have of ministering to people is through faith, because we do not have enough clinicians and psychiatrists and psychologists to do the kinds of counseling and the mass counseling, nor is it affordable or accessible to our people. So I'm challenging faith leaders to incorporate a greater sensitivity. Normally, after 9/11, we would have had memorial services that acknowledged 3,000 dead, and yet we're upwards of 50,000 dead. And very little has been said the way that it should have been said to acknowledge that amount of deaths, and we're not even through yet. So faith is paramount here. To those that are questioning their faith, there are many brands of faith in the United States. That's what makes the United States beautiful. But as a Christian, God never hid suffering from the tenets of our faith. It is exemplified by the crucifixion of his own son. And it was in the midst of the celebration of the Easter weekend or the resurrection weekend that we were in the midst of COVID at the same time. And it's important to understand that suffering is not absence from faith, but faith sustains us in the midst of our suffering. Now more than ever, we need to cleave to what we believe, because so many things that are still, there's so many variables that are still unknown, that we have to trust God and trust our leaders and officials who have the influence to do what they can do on earth, but they cannot do what God can do in heaven.
So good. Thank you so much, Bishop. We have one final question for you, Congresswoman, and that question is around the census. How can we demand more census sites in our area? And can a person offer their business location as a census site? And just in terms of level setting, we just have just a couple of minutes left. And I want to go around to recognize all of you. But that's the question, Congresswoman, with regards to census sites.
Well, Ivy, let me thank you so very much. But quickly, where we are right now, COVID-19 is going to delay any personal outreach. So where we are right now is to be able to encourage everyone to get online. And might I emphasize that the census is absolutely confidential, as I said before, and trillions of dollars depend on the census. So we are delaying for a period of time the outreach, the hiring of staff that will go out into the neighborhoods. We'd like that person to stand ready to offer their location in a few months to come. But right now, our focus is to get as many people to file online before we go to the personal door to door, or whether we have sites where various nonprofits could offer assistance for those to be able to fill out the census. And let me finish this point by getting a great thought by Bishop T.D. Jakes, being around during 9/11 as all of us were. And I would say that it would be worthy, since this is something we've never confronted, to have a national memorial for all of those that we've lost, so that people's souls can heal, for those family members of those who may be in refrigerator trucks, still may be there in New York because of the devastation, but that may be a way that we can heal this nation. I thank the bishop for his comments, and I certainly thank Dr. Williams for his instructive comments as well.
Thank you so much, Congresswoman. We are just about 3 minutes into wrapping up. This has exceeded my expectations in terms of a conversation that was both informative as well as inspirational, as well as giving people next steps. What can we do right now when we leave and end this call? We want to follow your work. We want to follow what each of you are doing. Congresswoman Dr. Elijah Day, Bishop Jakes, if you will give us a website where everyone that's a part of this call, we will also include this in our follow-up link that we send out to a massive database of individuals. If you can give with us, Congresswoman, your website where people who want to know what you are doing, where they can follow you.
Yes, I'll be happy to do so. My website is Rep Jackson Lee. Where's Instagram? Rep Jackson. Instagram. That's not what I want to do. Come back to me.
No worries. Dr. Elijah Day, people are fascinated by what you are doing on the front line. Where is a website for you or for the work that of Hip Hop Health where people can follow you?
So the website is hhph.org. hhph.org. And you can follow us at hhphorg. That's our Twitter handle.
Awesome. Thank you very much. Bishop, you have so much going on with regards to feeding the foundation. There's so many things. Where can people follow you to be up to speed on what you're doing and how they might support it?
Okay, they could go to TDJ, not TD Jakes, TDJfoundation.org and get more information about the foundation, or they could go to TDJakes.org and get just about anything related to TD Jakes. One quick thing I want to say to everybody listening, no matter who opens up anything, now people have to go back to work and I understand that, but theaters, dining halls, restaurants, bowling alleys, gyms, massages, all of that are optional. Don't let anybody make a mandate where you have control. You are the CEO of you. If you don't feel safe, do not go.
So good. Thank you. Thank you, Bishop. Congresswoman, if you can share with us where people can follow you and the work that you're doing.
I appreciate it. I have so many in my head. I have to pick the right one. jacksonlee.house.gov. I can be followed, but also you can do Jackson Lee TX18 at Twitter to be able to follow me on Twitter as well. So I will look forward to hearing from so many of your wonderful participants. And again, In Houston, Texas, we're setting up and have set up test sites in our neighborhoods, and we're going to do more so that people will feel comfortable with getting tested. And as Dr. Williams has said, get the right results and then be able to address whether they're positive or negative, and to protect their families, their seniors, and their children. I hope that we will be united around saving lives and doing it in the right way, rather than rushing to be part of the crowd to say that we're opening up our state or our counties or our cities without the adequate protection of our families.
Thank you so much. So well said, Congresswoman. I want to again extend to all of the participants that took an hour of your time to be a part of this virtual town hall discussion. I am a part of a number of conversations, meetings, and I wanted to bring together an august body of individuals that could tap into some of the information from the Congresswoman, from Dr. Olajide, and from Bishop Jakes. And we've learned so much, we've gleaned so much, there's so much information and insight, as well as there's a provoking to us to do whatever you can do in your community, because there are people right around us that have been hugely impacted. So I want to say thank you. I couldn't do what I do without an arm, an extension of people. So I want to say thanks to my mom, who's allowed me to set up a shop and transform her home into a studio and whatever is needed. I want to say thanks to the Ivy Inc. team, to Nicole, Nicole's family has been personally impacted. Her mother and her sister both experienced COVID-19. And can you imagine Nicole and her family, her husband live in Florida and her mother's in another part of the country. So thank you. Those who work with me have spoken with Nicole. And then there is Whitney, who is with her family in Virginia. And then we're appreciative of Hamdi, who has served on the front lines in Seattle with the governor in Seattle. And then Keenan, who is newly on board helping us digitally. And I'm appreciative because, again, we can't do what we do without a team of great people that serve and assist us to help us do this. So for everyone that's been a part of this, I want to say thank you for joining us. You can continue to be a part of Monday Mentoring Moments by simply going to Facebook and looking for the Ivy Inc. Soars group and being a part of that group, where we are committed to two things: to serve and to soar. To our distinguished panelists and guests, to my friend, Dr. Olajide, we've been friends a long time, and he's a one call for anything to do with health. I mean, anything. Dr. Olajide, I salute you. I thank you for your friendship, but I thank you for your service, years and years, to the disparities of people that look like you and I. Congresswoman, when I lived in Houston, you were not just the Congresswoman, but you were and remain a friend, a person that I could call or text and say, what about this? And you would bounce ideas off me as well. And I'm appreciative of long-standing friendship. And I salute you and all of the work that you are doing, not just for the 18th Congressional District, but for these United States of America. Bishop Jakes, you are the voice of faith across the country. And in times of crises, it has been a soothing and comforting and reassuring to see your face on every single media outlet, offering prayer on national news, offering voice, offering wisdom, wise counsel, and peace, and blessed assurance. And I want to say thank you for who you are. Thank you for your covering. Thank you for loving our nation and offering what you do. And because we are who we are, I'd like to end this call, Bishop. We have about 2 minutes left, and ask you if you would close us in prayer.
Father, as we bow our heads, we thank you for this opportunity and this medium and this forum whereby you have placed it in the heart of Ivy, your servant, to coalesce us together that we might have this dialogue. And to all of those that are listening to it and shall listen to it, we pray a special blessing. Our hearts go out to those that are bereaved and those that are in mourning and those who have grief and those who need comforting. And we ask you for your presence of your Holy Spirit to comfort them and to ease the torment and the agony. For all of them, Lord, that are on ventilators tonight, that are in the hospital, that are in pain, great grace to them. To all of them that are providing service to them, the physicians, the technicians, the therapists and nurses who are putting themselves at risk and worrying, and some of them growing ill themselves. We ask for your protection and your covering, and for our country and for countries all over this world. We share this enemy in common. We share our Creator in common, and we ask our Creator to cover us from this enemy. In Christ's name we pray. Amen.
Amen. Thank you so much, Bishop. Thank you, Congresswoman. Thank you, Dr. Elijah Day. And to all of our participants tonight, thank you for being a part. We'll see you next Monday, same time, same place for Mentoring Moments. God bless you all. Have a great evening. Thank you.
Thank you, Abby.